Okay, so here we have a 30-year-old woman who comes to the clinic due to intermittent shortness of breath, wheezing, and chest tightness for the past 2 weeks. The symptoms worsen at night and early in the morning. She has had 3 emergency department visits over the last few months with similar complaints, which improved with nebulized medication. She has not reported any fevers between production or recent illness. She has a history of eczema and allergic rhinitis. On examination, her lungs revealed diffuse bilateral expiratory wheezes. Chest X-ray is normal. Which of the following is the most likely mechanism underlying her symptoms? Right. So this is sort of a classic case of asthma, right? Okay, so asthma. Right. So the answer for this is clearly A. Right. So remember, you have the IgE here, right? And you have like a cross-linking with the antigen right here. So antigen. And then if these then attach to a mast cell, you're going to end up with degranulation, right? So stuff like histamine is going to be released, right? So histamine, right? Tryptase, right? And leukotrienes are going to get released from the mast cells, all right? Now, if you look at the other options, pulmonary infarction from thromboembolism, right? So you usually find some sort of like pruritic chest pain. You're going to have rapid onset shortness of breath, right? So you get some hypoxia, tachycardia, that sort of thing, but you don't really see expiratory wheezing, right? For the next option, that's with emphysema, right? So things to remember about emphysema, you have the two types, right? The centroacinar and the panacinar, right? So the centroacinar, let me just switch this a bit, right? So centroacinar, right? So that's linked with smoking, right? So you usually see this in older people, right? And then you've got the panacinar, right? And that's the one that's linked with the alpha 1 antitrypsin deficiency, right? Antitrypsin, right? So now remember that this alpha 1 antitrypsin, its duty is to sort of inhibit elastase. And elastase, like being produced by the neutrophils, sort of breaks down the elastin in the walls of the alveoli, right? So if you have a deficiency of alpha 1 antitrypsin, you end up with sort of, let's say, rigid alveoli because all the elastin is broken down, right? And now with that, you're going to see sort of like a barrel chest on X-ray as opposed to this patient who has like a clear X-ray, right? And you're going to get like the chronic cough and dyspnea, you know, that sort of thing. And then for the small vessel vasculitis, right? So this is basically, let's say, referring to something like Wegener's, right? So remember, that's the one that affects and this upper passage, the lungs, and the kidneys, right? So you end up with hemoptysis and cough, and you can see some infiltrates on imaging. Okay, for the granulomatous inflammation of the lungs, right? So if it's like a non-caseating granulomatous inflammation of the lungs, so they're sort of referring to sarcoidosis here, right? And remember that this is mostly in African American females, right? And you can then see the bilateral hilar lymphadenopathy that's sort of pathognomonic for sarcoid. Okay, and you end up with cough and some questions that will give you stuff like the erythema nodosum or tell you that there's uveitis or something like that. Okay, all right. So yeah.